Hey everybody, let's have a little chat. I have this machine. It comes from Hong Kong and it will test you. It will test nutritional deficiencies, everything going on in your organs. All you do is you put your finger in here. As long as you don't have a pacemaker and you don't have a smartwatch on, you can do the test. It will give you 120 pages of data letting you know where you're at. Now let's talk about what it tests. It tests your vitamins, minerals, and coenzymes. So pretty much everybody's got a nutritional deficiency there, if not a bunch more. We're not getting the vitamins and minerals we need from our food, so we should be on a multivitamin, whether it's one of these types, which have multiple capsules, or a one a day, or a patch, just whatever you can get in you. You're probably gonna have a deficiency somewhere. Now, the next is it tests for essential fatty acids. It's testing for 6s and 3s, and usually everybody's got a deficiency somewhere. This is a complete formula that covers the 3, 6, 9, and it's got multiple ingredients. This is one I highly recommend, but we have lots of other variations, and if you like, you can get it in a patch as well. It tests your collagen levels. Now, so many people think that collagen is for hair, skin, and joints. Correct, but it is for a lot more. Collagen is actually for your eye, your tooth, your endocrine system, circulatory system, digestive system, immune system, muscle tissue, fat metabolism, detoxification and metabolism, reproductive system, nervous system, skeleton, the hair and skin, and the motion systems, which is your joints. So collagen is very, very important, and pretty much everybody's not getting enough. It also tests your heart, your cardiovascular system. At age 40 to 50, half the population has arterial sclerosis. This product can help improve your cardiovascular health, and so can walking and running and hiking. So if you're not doing cardio because you think it's a joke or it's bogus, I'm here to tell you you're wrong. You need to do cardio. It helps your heart, and you can take great supplements that help to kind of get the arteries in a lot better shape. Okay, it also tests your liver. Do you know how many people have fatty liver, and why do we get it? From excess sugar, excess trans fats, prescription drugs, just extra weight on your body, alcohol, drug use. And if you did that in your teens and you never cleansed your liver, it's probably still there. Fatty liver will show up on your test most likely. You can also exercise a bunch. That helps cleanse your body. It helps the detoxification, but milk thistle and other products help as well. The test also will test your joint health, your bones, all kinds of stuff. I find out if people have a bit of rheumatism, arthritis, or osteoporosis, this is a really great product here that helps with that. It helps strengthen your bones as well. A lot of times your nutritional deficiencies will be playing into it as well. Okay, gut health. Your test will show you if you need digestive enzymes. There's 3 factors in the stomach. There's absorption, there's peristalsis, which is the movement, and there is your stomach acid. Your stomach acid can, if it's really low, there's a betaine, which is a HCl you can take to increase your stomach acid, and the enzymes will help. When you take them 5 or 10 minutes before a meal or with your first few bites, you will prevent the gas and bloating and discomfort that you often get when you're eating because your stomach's not functioning properly. Also, many people are low in probiotics because they have had a dose of antibiotics, or they've just had not enough fiber in their diet, or a lot of things that haven't supported good gut bacteria. So there's lots of probiotics here to choose from and lots of foods you can eat to increase that. Now, it does test your thyroid as well. I haven't seen anyone with a test, with markers in the yellow and the red, which means do something now about it. Most people are just in the blue. The thyroid's not a huge concern, but we do have products here to help support that if that is an issue for you. Okay, now I'm going to talk about some of the main deficiencies I see on the test. Vitamin E, this is a big one. So many people are vitamin E deficient. A lot of that comes from nuts, and people aren't eating that like they usually do. So another deficiency or issue I'm seeing in men as they get older is usually a zinc deficiency or prostatitis. The prostate can shrink or enlarge as they get older, so men need to be very proactive with that. We do have a pros formula includes zinc, but it's something to think about getting on maybe when you start hitting around 40 or 50 years old. Look after your health there, guys. Another deficiency I see very regularly is CoQ10. So many people are deficient in this, and this one is heart health related and much more. Very important for your cardiovascular system. You can get it not in a patch as well, but this is something I like to show because a lot of people don't want to swallow too many capsules. Biotin is another deficiency I'm regularly seeing with everybody. You can get it in capsule form as well, but these gummies taste great, so I highly recommend. Vitamin C is another big deficiency for so many people. That one's important for your immune system, but also for collagen formation. So don't get down on your vitamin C. If you like to take it naturally, buy a bag of oranges and eat an orange a day. Otherwise, the gummies are fun, and there's also capsules and powders and all different kinds of ways you can take it. And another deficiency that is common and very important is a calcium deficiency. This one is for your bones to prevent osteoporosis. Osteoporosis is when the bones start getting brittle and are easily breaking. So many times you've heard your aunt or your uncle or your dad or your grandma has had a hip surgery or a knee surgery. You can be proactive and prevent that. So stay on top of your calcium, your nutritional deficiencies, your collagen intake, your omegas, and hopefully you won't suffer with any bone issues. There are more deficiencies I commonly see, but I've covered some of the main ones. If you're looking to get a test and get any more insight, we offer tests here at Edge Nutrition. So be sure to come in and schedule your test and come see what your mind or your body intuitively pulls you to. You might see a vitamin and think, I should take that, and it's your intuition probably telling you you need it. Have a great day, everyone.